Nose filler can actually, with time, make your nose look bigger and wider. And that is because nose filler can migrate with time.
So what is she saying here? So first of all, she's saying that if you keep re-injecting the nose with hyaluronic acid filler over time, the nose gets thicker, less defined, less aesthetically appealing. I think that's kind of true, especially if you inject it in the way that's being demonstrated here, which is using this cannula. I think it's really hard to have good control over where the filler is when you use a cannula in the nose. And this is why I use these little tiny syringes to give me very, very precise injections in very tiny amounts so that I can get the best effect with the least amount of filler so that my definition is maintained and the aesthetic contours of the nose that are natural and that are attractive are maintained. The other thing she's saying is that over time, hyaluronic acid in the nose tends to shift or migrate or slide around. And again, I don't know, if you put a lot of it, as one could do with a cannula, that may be the case. But once again, the way I do it with tiny, tiny injections, over 20 years, I really haven't seen that happen very much at all. I don't think it happens if the injection is performed in little tiny aliquots of 0.01, 0.02 cc's like I do with those little BD syringes. And my last point is that this is exactly why I transition a lot of my temporary non-surgical rhinoplasty patients to permanent filler, because I don't want to keep re-injecting them year after year after year. We achieve a good result. I transition them to permanent filler as long as they understand it's not reversible, you can't do surgery afterwards, and they agree with that. Do it a couple of times and then they're done and we don't have to inject them again. Easy. So I hope all that's clear. I'm not trying to create drama. I just want to dispel any kind of misconceptions around a procedure I really love, which is non-surgical rhinoplasty, because it makes so many people so happy. I don't want people thinking that there's all sorts of patients running around with filler sloshing all over their nose over time. It doesn't migrate if done properly. So, thanks.
Do cosmetic filler injections with hyaluronic acid really cause cancer? Of course they don't. But these articles get published and then patients come into my clinic and I have to explain to them this is complete baloney, right? So this is a great example of how these kinds of rumors and extreme stories propagate all over the internet. I'm talking about this now because I just went to Vegas Cosmetic Surgery Conference and this came up as one of the conversations on stage in terms of what do we do about all these myths that are all over the place on social media. This started when a plastic surgeon from New York presented data that under eye filler can obstruct a little bit of the lymphatic flow in that area after injection. Now, this is not a new observation. We know this, and we know it causes no clinical impact. And as a matter of fact, if there's a little bit of swelling afterwards, you can always put a little bit of enzyme in there and dissolve the filler, and everything goes away and it's all fine. Now, the issue is that then he speculated that this little bit of blockage will cause health problems. Is there any evidence of that? None. And so this journalist then went on to say, oh, well, if it causes health problems, it must cause cancer because lymph nodes have something to do with cancer. Ridiculous. Anyways, I don't see this paper in PubMed. I don't think it ever got published because the evidence is weak. But, however, of course, the rumor gets started and goes on and on. And so we have to talk about it. Thanks. There was an article that was just posted in Allure that I thought was really quite good. It talked about how some injectables can make a future facelift more difficult, technically more complicated, and more risk for complications as well as poor results. She talked to a bunch of plastic surgeons who agreed that using a lot of biostimulants like dilute radius or Sculptra, or using threads, or using deep energy devices like Ulthera or like some of the RF energy devices could cause scarring. Because what we're talking about when we talk about stimulating collagen is that we're causing controlled scarring. Now, for most patients, that's quite effective in doing what we wanted to do, but for some, they scar more than others, and sometimes those patients can't present with issues. Now, I've spoken to a bunch of plastic surgeons as well, and they say that most of the patients they operate on have had something like biostimulatory or energy devices, and it's no problem to do the operation, but occasionally you can get a problem. But in my conversation, what I consistently hear is that what complicates their facelifts more often than anything else is poorly done previous procedures like starter facelifts or mini lifts, and things like that people get when they're not really yet ready for facelift, and they're not good candidates, but they get them on the cheap because they think that if they get it early, they can have better results later on. So what to do? Read the caption. We are here with Rhonda. Rhonda, how long have we known each other for?
20 years.
20 years, man. It's a long time. She's actually, I mean, I look like hell. With over 20 years, she looks great. She looks the same as it was 20 years ago. What I want to do is just bring her chin down a little bit. Her projection is okay, but I'd like to round out her chin a little bit and then bring it down a little bit. So basically that her lower third of her face is in proportion, the proportion that we want, which is 1/3 here, 2/3 here. Okay? So I'm going to use Volux, which is frankly my favorite filler for the chin, to advance the chin area. It's robust enough to bring tissue forward or down or whatever direction I want, but also reversible and with a nice smooth result as long as you have a lot of tissue coverage over where you place the filler. So here we go.